In my private sector, I mean, people that paid me, right, in order to coach them to pass the NCLEX exam, I shared 3 powerful strategy or something they need to know about the NCLEX exam, right? But right now, I want to give you one of those things I shared to them, right? So pay attention. It's all about understanding the psychology of the NCLEX. This is very powerful. So I want you to pay attention, right? Now, one thing I want you to know, I'm going to use uh beta blocker as an example, right? The NCLEX does not want to know if you remember what a beta blocker is, right? I repeat, the NCLEX does not want to know if you remember what a beta blocker is. It wants to know, will you kill your patient with it? Right. This is the NCLEX psychology. One thing I teach my students is this: how to understand the mindset of the examiner. And that's powerful. The moment you can understand the mindset of the examiner, you can start thinking like the NCLEX writer, and automatically you know the kind of answer to select. It happened like that. Now, let's go through some beta blocker question that right now on my screen right now. This is a question on beta blocker previously tested on the exam. This is not random question or question I created. This is question that was previously tested on the NCLEX exam. Right, so this is the NCLEX past question. This is not question bank. This is not ASHA. This is not UWord. This is not anything like that. So it means I'm teaching you directly, right? I'm teaching you directly the mindset of the examiner. We are going to do 2 questions and let us see. Now, pay attention to this question. This is what I tell my students. If you watch previous of my videos, you will see me saying this, right? Your question have 3 parts. You have the body, right? You have the stem. This part is the body. This part is the stem. And then this part is what I call the answer keys. Right. The reason why you need to know these 3 parts is because they interpret how you answer the question. Right. Because this is not your regular nursing school question. Nursing school is all about knowledge-based question, right? But NCLEX is practice-based question. Right. Nursing school try to test you on retaining knowledge, but NCLEX test you to use that knowledge to show that you can practice. Are you understanding me? Now, because this is nursing school. Nursing school give you the knowledge you need in order to take the exam that make you a nurse. So finishing nursing school don't automatically make you a nurse, right? You need to utilize that knowledge, grab the knowledge from nursing school, then utilize it in order to pass the exam that automatically make you a nurse. That's why I always used to tell students, in order to become a nurse, you need 2 things. You need what? Your nursing school, and you need the NCLEX. Right. So, yes. So you need to understand now. The body give you what is going on or tell you the content that the examiner is testing. Right. So, if you don't understand the body of your question, you will miss out on the understanding of the stem. The stem is the examiner question, right? And your answer key are pre-existing question for you to answer. A lot of students think answer key is just for you to just select the correct answer. No, the answer key is there for you to question them, because NCLEX right answer keys like they are correct, but you have to question it and say, why should I do this? The moment you keep asking, why should I do this? Your why should not be outside this question. Your why should be related to what is going on in the body of the question. Remember this, right? This is powerful. But on a normal day, you need to have content knowledge. That is the reason why in my course program, the first 30 days is for content knowledge, right? Because you need content knowledge. That way, every content is just like now. NCLEX is not magic, right? NCLEX understand that when you finish nursing school, you have thousands of nursing school knowledge. So they don't, obviously they know you will be overwhelmed, because with all these thousands of knowledge, you don't know where the question is going to come out from and all that kind of stuff. So NCLEX don't want you to have all those kind of struggle. That is the reason why they created what? The NCLEX test plan. Right. Your program is not going to tell you this, but I'm going to tell you. That is the reason why they created this NCLEX test plan, because they want you to have what? A focused study. So instead of thinking about what will the NCLEX test, the test plan has already provided what it will test. So if you go on the NCLEX exam, this is not going to be new to you because the NCLEX test plan has have it on that particular document that they will test you on what ECG. So when you see ECG, you should not be surprised, right? There's no content on the NCLEX exam that you should be surprised about, right? The registered nursing have 146 content on the NCLEX test plan RN, and then the PN have 150 content on the what NCLEX test plan PN. It's two document, right? One for PN, one for RN. And all this content, when you check the body of your question, you are going to identify it. So this content, I have broken it down with my paid students that they need to finish this content in 30 days, right? Whereby they need to do 8 per day. You understand? So within 30 days, they will finish every of them, right? And now they will now be ready to use the next 2 weeks because my program is 8 weeks program, right? Now they'll be ready to use the next 2 weeks to do question, and then the last 2 weeks for strategy, right? So yes, this is how you pass in it 5 question easily, right? So let's get back to the question. Now, since I'll be answering this question now, if like you know the content. Now, the moment you can spot what the uh body of the question is saying, like you know the situation surrounding the body of the question, and you understand what the examiner is saying, now you need to take the answer key one after the other. A lot of students will read all the answer key. No, that's not how you want to do it. No, you need to take it one after the other and then ask yourself a question related to the scenario. Now, I'm not going to go through everything, but let me go through the beta blocker because it's beta blocker I want to talk about. Now, look at what the examiner is saying. I will tell you how most students think, right? Now, a particular student said, administer the client prescribed beta blocker. Now, the student said, oh, the beta blocker has been prescribed already, so there's no need to call the doctor to prescribe medication. We are going to give it because it's already prescribed. That is why she said number 1 is correct. You see, this is the reason why you need a coach, somebody that can guide you through how the NCLEX wants you to think. Because there are a lot of things, a lot of people who have heard, listening to, that is giving what confusion. Because one, they don't try to understand what the question is saying. They just try to understand things that people have said to them or made mention to them, right? And they all deal with what? Quick fat. NCLEX is no quick fat exam, right? NCLEX is a particular exam that have to do with what? Clinical judgment, critical thinking, right? If you don't understand that aspect, trust me, it will be difficult to fail the NCLEX exam, right? Don't take the NCLEX exam until you understand those things. Now, look at our thinking, right? The medication has been prescribed. I'm not like, what happened to this? Okay, it has been prescribed. Should you now give it? What happened to you, the nurse, questioning a particular order in some certain situation? He said, but there's nothing that is saying we should. I said, do you understand what is this? She said, okay, it looked like bradycardia. Okay, if it's bradycardia, why do you want to give beta blocker? All of a sudden, she said, it will help increase the heart rate. I said, okay, wait a minute. What do you use beta blocker for? He said, for hypertensive patient. I said, okay, that's correct. Now, how does beta blocker work? Tell me the mechanism of action. And she was like, it will help to reduce or increase the heart rate. Now you don't know it. So you can see the reason why a lot of students will go on the NCLEX exam and second guess themselves. If you don't understand the NCLEX as at yet, or understand the content, don't go and take the exam. You are not rushing. Nobody's taking your position. Be patient, right? Now, you need to understand that truly this medication has been prescribed. Yes, it has been prescribed. The doctor wants you to give it. But guess what? Look at what the examiner is saying. He said the nurse is caring for clients who report what? Feeling faint, right? And experiencing the cardiac rhythm shown in this particular image. Now, the nurse is right here and she's caring for this particular client on the bed. Now, beside the client, there's the cardiac monitor, right? Beside the client. Now, the nurse came in and noticed that the client is feeling faint. right? And then she checked the cardiac monitor and find out that this is what she's seeing on the cardiac monitor. Now, guess what? The examiner is now asking you, which of the following action would be appropriate for the nurse to take? Right? This is, I just painted your scenario out for you right now. Now, what would you take based on what you've seen? Now, one of the answer keys is to administer the client prescribed beta blocker. Now, the patient have the medication chart and beta blocker is there prescribed. But guess what? NCLEX is not trying to tell you to perform your duty as a nurse by administering medication. NCLEX is trying to test to see that you should give the medication. You know the medication should be prescribed before you give it, but do you know you still need to find out if there's any specific reason why you should not give the medication? And this is what the NCLEX is not telling you, because NCLEX just gave you the ECG reading. NCLEX did not tell you what the ECG reading is all about. Right. Meaning the NCLEX want you to interpret this and then interpret this. Interpret this towards this. Interpret this towards this. Interpret this towards this. Interpret this towards this. That is what the NCLEX want you to do. So now you are going to ask yourself, what ECG is this? Obviously, this is what? Sinus bradycardia. Right? Now, if I give beta blocker that was prescribed, right? Guess what? What will happen? Oh, because now this patient have 1, 2, 3, 4. So 4 multiplied by 10, that is 40. Your heart rate is 60 to 100. Obviously, this patient have what? Bradycardia. Now, if you give beta blocker, what will happen is going to drop it till what? The patient what? Die. Now, when I explain this, the student did not get it. Do you know the reason why? The student is still focusing on what? But the medication has been prescribed. Do we not give a medication that have been prescribed? Now, she is very far from the way the NCLEX want students to think, right? Because she's still thinking like a nursing school student instead of her to be thinking as a nurse. Because NCLEX is testing your readiness to become what? A nurse. Right. But you understand what I'm saying? Now, let me go to the next question. Now, look at it right here. The nurse is preparing to administer a beta blocker to a client. Now, look at this situation. We are preparing to administer the beta blocker to the client, meaning we have gone through audio check, everything, allergy, right? But now the NCLEX is now asking, which of the following would be contraindicated to administer the medication? Now, we are preparing to administer this medication, but there's one thing, right? Because this is not a select all order apply question. So meaning there's just one answer. So that's what I'm saying. There's one thing. So there's one of these that will make us not to give this patient this medication. So this is not about saying, oh, I'm expecting the NCLEX to tell me the patient have low heart rate, or I'm expecting the NCLEX to say the patient have low blood pressure, right? Because a lot of students will be saying, oh, there's nothing in the answer key that is saying the patient have low heart rate. There's nothing in the answer key that is saying the patient have low blood pressure. There's nothing in the answer key that is saying the patient have what? Asthma or COPD. Or there's nothing in the question that is saying maybe the patient have diabetes and all that kind of stuff. All kind of things that make giving beta blocker a contraindication. Right. So now it means that what the NCLEX wants you to do is to interpret each answer key and see a reason why you should not give what? Beta blocker. So now I need to ask myself, what is going on here? 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 Heart block equal, let me just say it like this. Heart block equal bradycardia. Right. This just have to do, this is an issue with what? The muscle. Right. Heart failure is an issue with what? Pumping. Angina is what? Pain. So now I need to ask myself, beta blocker, because heart block equals what? Bradycardia. Now, beta blocker, this is bradycardia. Obviously, this is why I should not give beta blocker. This is my contraindication. So beta blocker muscle, I've not seen any reason why you should not give beta blocker for a patient that maybe is experiencing MI. Right, because the issue here is just their muscle damage, right? So that does not have anything to do with what beta blocker, right? Pumping, that does not have anything to do with beta blocker. The pain, that does not have anything to do with beta blocker, right? So the only issue right here is what? Bradycardia, and that is one. So one will make us to not give this medication. Now you can see how NCLEX wants you to think. Right. You can see how NCLEX wants you to think. Okay, let's proceed. Now, I want you to know this. The exam is psychological warfare, right? It's about pressure, decision making, and safety. Now, listen to me. So if you are still cramming fat, I said that previously, you are playing the wrong game, right? NCLEX equal safe nurse test, not smart nurse test. So you want to train your brain for clinical judgment and not trivia. A lot of students answer questions like it's like maybe a guesswork or something like that. No, you will fail if you do something like that. And we don't want to fail the NCLEX exam, right? So now you need to understand the NCLEX exam. Now, I want you to know this, right? I told my paid student this. Use mental cognition, right? You want to think about how you are thinking, right? So think about how you are thinking. Always ask, what is the test trying to make me believe? And what does a safe nurse actually do in this situation? Now, let's go back to this question so that we use that kind of thinking. Ask yourself, what is the NCLEX trying to make you believe is happening? And what would you do in the situation? Because if you don't know what is happening, guess what? You will not be able to decide the answer keys properly. Now, what is happening? What is the NCLEX wanting us to believe? Because the NCLEX did not tell us what is happening. They only just gave us this image. So we now have to figure it out. Now, patient is feeling faint, and I'm looking at the image. I'm saying, okay, all right, okay. Now, let me now give you a master class real quick. Now, let's forget about this for now. Let me tell you a way you can easily know what the NCLEX wants you to believe. Now, NCLEX want you to understand that to one extent, you should know about intervention. I wish you to tell my student this. There are key things you need to know in nursing. Vital sign. NCLEX will never provide you normal range for vital sign because they believe you should know the normal range. Yeah, you can see normal range for labs provided, but no, vital sign never. Right. You need to know the 10 body system. You need to know intervention. You need to know complication related to the 10 body system, right? You need to know your nutrition. You need to know about exercise. You need to know about lifestyle modification. There are a lot of key things. There are fundamentals you need to know, right? The most important thing right now is intervention related to the 10 body system. Right. Now, this is an intervention. This is an intervention. This is an intervention. This is an intervention. This is a certain assessment. Or assessment too is also intervention too. Right. It depends on how you want to think it. Now, you are not going to ask yourself, we don't know what is this, but look at us, we are going to know what is going on. Now, pay attention. Now I'm going to ask myself, why do we do this? 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 You definitely need to know why do we do this, because explain to me why you answering the NCLEX question in the first place. You don't know what is going on in the body and you don't still understand the answer key. It makes no sense. You understand? Because it means that you don't know this, you are not ready to take the NCLEX exam, because you need to either don't know this and know this, or don't know this and know this. You cannot just don't know the two. It's not possible. Now, administer beta blocker. Now, at that point, I will start saying, okay, maybe this patient have high heart rate or high blood pressure. So that is my thinking. Let me erase this. So that's my thinking. Let me just write it very clearly. Now, so at this point, I will be thinking, I don't know what is going on, but I'm thinking maybe this patient have increased heart rate or increased blood pressure, because that is what we use beta blocker for. It makes sense, right? Now, what do we use transcutaneous pacing for? That is to increase the heart rate. So I'm going to say maybe this patient have what? Low heart rate. Now, I'm seeing something similar. So it look like there's possibility this thing I'm seeing right here have to do with heart rate issue, because I'm seeing something related to heart rate. Now, Vassova maneuver as well too is used to decreased heart rate. So it means that maybe the patient is having what? Increased heart rate. Right? So now I'm seeing increased heart rate, decreased heart rate. So something is talking about heart rate, heart rate, heart rate, heart rate. Now, what is chest compression used for? Chest compression is used for someone that don't have any heart rate. So now this one is saying no heart rate. All this is talking about heart rate, heart rate, heart rate, but this one is saying no heart rate. Now, what is angina? Angina is chest pain, right? And since everything I'm seeing right here is related to heart rate, so I will not even be thinking that the last answer might be testing me on maybe angina can cause heart rate. And when I'm thinking about it, angina actually can cause what? Low heart rate, right? Low heart rate. So I'm not like, okay, low heart rate, I increase heart rate, and all that kind of stuff, no heart rate, and all that. So I'm thinking everything is related to heart rate, heart rate, heart rate, heart rate. So I definitely know the question is not testing me on blood pressure. So it's heart rate issue. So now, since it's heart rate issue, I'm not going to ask myself one simple question because NCLEX is giving you clue here. Now, ask yourself, what causes a patient to feel faint? Increased heart rate or decreased heart rate? Obviously, decreased heart rate is what that causes a patient to feel faint. So even if I don't know what this is all about, I definitely understand that what is going on is slow heart rate. So my answer now will now be related to fixing what? That slow heart rate, because the NCLEX is not asking which of the following answers should you not do. Instead, the NCLEX is asking for the nursing action. And when the NCLEX is asking for nursing action, it means that NCLEX is asking you for the correct not nursing action. Now, this is masterclass that I'm giving you right here, because right now I can easily think and say, okay, we are dealing with what? Low heart rate. From my analysis, we are dealing with low heart rate. And my analysis was done using what? Just the answer keys, right? That's what I'm telling students. You need to understand the body, the stem, and then your answer keys, because your answer key is not just an answer that you just bypass. Your answer key also give you what? The extra understanding towards your question. You are a nurse, so all these things are things you should know as a nurse. It's not nursing school question. This is NCLEX question. You need to understand how the NCLEX want you to think. Okay, now, so I know we are dealing with what? Low heart rate. So I'm not going to look at the answer and see which answer will contradict what? Low heart rate. Obviously, beta blocker is going to contradict low heart rate because it's going to reduce the heart rate more. This is going to increase the heart rate. This is going to reduce the heart rate. We don't need this because the patient obviously have pulse. Right, because I can see the ECG and the patient what? Have pulse. Right. And the question did not state the patient don't have any pulse, because we only do this when the patient don't have pulse. So this is not a correct answer. Now, if I am doubting number 5, remember something, this is a select or apply question. And it makes no sense that select or apply question have just one answer. So if I have eliminated this, I have eliminated this, I've eliminated this, which I am 100% sure those answers are not correct, then this is a smart way to say this is your second answer. And you can never go wrong. That's what I'm telling students. It's difficult. It is difficult to fail the NCLEX exam, right? You can easily pass the exam because there's a smart way to think. The moment you know how to think as a nurse, you are going to beat the NCLEX in 85 questions. And this is what I teach in my coaching program, right? So a smart way to answer NCLEX question. Now I'm going to leave you with this last question, right? I want to give you a perfect thinking, right? This is just going to be powerful, right? Right. I do this for paid student, but definitely I just want to drop this good right here. Now, pay attention to this question, right? We have the body right here. We have the stem. And then we have what? The answer keys. Now, think through this question with me. Right. If you, this, obviously, this is a particular question that was previously tested on the NCLEX exam. If you have attempted this question before, then you are going to cheat the process. But if this question is new to you, let us answer this question. Right. So pay attention to the question. Now, it is rare because right now I will tell you something right now. Let's read the question before I go into it. Now look at it. The nurse who is pregnant is assigned to care for a 3-month old with what? RSV, right? Pneumonia. The client is receiving this particular therapy. Now let me tell you one secret of the NCLEX exam. Now, I will just give you this. This is a particular arc you need to know. Now, when the NCLEX is writing something like this and they put full stop, it means that all these things that is right here, they are not relevant again. The next thing that the NCLEX put in front of this is what you should pay attention to. Now, if you are reading this particular question, you will notice the NCLEX is saying a lot of things, right? They said the nurse that is pregnant is assigned so, and then there's a foot stop right here, and then the NCLEX continue. That last thing is the real problem currently that is happening with the client. So this is the current situation. So we are dealing with the current situation right now. So the patient is what? Receiving this particular therapy. That is the thing. Now, another thing is when you are caring, right? When you are answering question, because normally there are a lot of things you can see in your question. You can be in your question. You can is either NCLEX will put the charge nurse in that particular body or you the nurse, right? But right now, and if it's the charge nurse, you need to understand the role that that particular charge nurse is playing in that question to see how that role influence the question. Now, if it's also the nurse, you are going to find out the role the nurse is playing in that question, or the situation with the nurse, or the situation with the charge nurse, to find out how it influenced the question always. And who are they dealing with in that question? The charge nurse might be dealing with another nurse, right, and client, right? But the nurse can only deal with either staff member and what? Client. So right here, we have the nurse, right? And what's going on? NCLEX described the nurse. NCLEX said the nurse is what? Pregnant. So we have what? A pregnant nurse. The pregnant nurse is assigned to this client, right, with this particular condition. But guess what? This condition, we should have been thinking about it. But the moment NCLEX place a foot stop right here, it means that that is not the main concern again. I'm giving you arc. But let me now explain why I'm saying something like that, so that some people that easily grab the arc go with it. But if you need explanation, then fine. Maybe use that explanation to answer more questions. Now, it's just like right now. The NCLEX is saying a patient have increased blood pressure of 170 over 100 and receiving their atenolol. Now, guess what? This patient don't have any problem again, because yes, NCLEX stated they have increased blood pressure, but now they are already receiving medication. So there's nothing you need to do than what? Evaluation, right? So now, that is what is going on right here. But the nurse, you need to understand the situation with the nurse. Is the nurse having any situation as well too? Because obviously in healthcare, the nurse can have a problem, the client can have a problem. Right. That is how the NCLEX work. It's not only about the patient, the client all the time. Sometimes it can be about the nurse too. So you need to pay attention if the NCLEX is saying something about the nurse, because most of the time your question will just say a nurse and nothing more. But right now, this question is saying a nurse who is pregnant. It means that the NCLEX is saying something about the nurse, because who cares if the nurse is pregnant? Why is the NCLEX telling me that? It means that there's something concerning about a situation. That's why NCLEX is making you know about that situation. She's pregnant. So it has something to do with the question. But the patient have this condition, but they are already receiving therapy. So they are receiving therapy. So right now, since I feel like this question have something to do with the nurse or the client, I need to look at the examiner question and as well to the answer key to see, are we trying to deal with the client situation or the nurse? Are we trying to deal with the client situation or the nurse? Obviously, if we are trying to deal with the client situation, it means that we need to do what? Evaluation. Because the patient is already receiving medication. After receiving their treatment, the next thing you are doing what? Is evaluation. Or another thing you need to think about is there are some medication, when you are administering that medication, you need to protect yourself against that particular medication. So there are three things NCLEX can test right here. Is either NCLEX, you see, I've not even gone through I've not started reading what the examiner question. I've not gone through the answer key, but I have all this understanding already, because this is how you need to think as a nurse, right? Now the nurse what is pregnant. So that's one situation of the nurse. So the NCLEX can either test us something related to the nurse or the patient. But guess what? The patient is already receiving therapy. So now it can be two ways. Is either there's something about the therapy that the patient is receiving that we need to protect ourselves as the nurse, or we need to do evaluation of what is going on. That is what the NCLEX is testing. Now look at what the examiner is now saying. Which of the following action would be appropriate for the nurse to take? Now the pregnant nurse want to take action. We have action 1, action 2, action 3, action 4. Right. So now look at action 1. Maintain transmission-based precaution while caring for the client. So now option 1 is trying to say it seems like there is a problem with this patient that we need to take a certain precaution. But guess what? Let me tell you a secret of the NCLEX exam. NCLEX don't like vague answer. NCLEX like specific answer. So this is one secret that I'm telling you today. I've shared a lot, but yeah, let this be important to you. Now, NCLEX don't like vague answer. NCLEX like specific answer. NCLEX don't know what transmission-based precaution means. NCLEX know airborne, droplets, and contact. All together make what? Transmission-based. So you need to be specific. It's just like right now, a patient have tuberculosis, and I'm telling the staff member to maintain transmission-based precaution. What does that mean? That is wrong. That is a wrong thing to say. Instead, you need to say, staff nurse, I want you to do airborne precaution for when you are caring for what? This client. And even if the nurse even say airborne precaution, that is still vague, but it's still acceptable on the NCLEX exam. Because on a normal day, NCLEX will tell you, should I? I don't want to add anything. I just want to say exactly what the NCLEX wants you to know. All right, let me just say exactly what the NCLEX wants you to know. Airborne, NCLEX can just tell you, maintain airborne precaution. That is not vague. Right. Right, that's not vague. But is it that the NCLEX can tell you maintain airborne precaution, or NCLEX will say use your N95 when caring for a client who have what? TB. Right, any of the two, right? Because I've seen NCLEX also saying do droplet precaution. I've seen that, right? Also, so I will not say that is vague, because that is not considered vague, right? I'm just trying to just add my thinking. I don't want to add my thinking. Now, so that is it. But transmission-based precaution, because we have two types of precaution. We have standard and we have transmission-based precaution. So since we have standard and transmission-based precaution, you need to now understand what is in standard, what is in transmission-based, because the two are vague, right? So transmission-based is airborne, droplet, contact. So NCLEX saying maintain transmission-based precaution is wrong. Instead, NCLEX should have said maintain what? Airborne. So now a lot of students will be saying, oh, this is maybe, I don't know, maybe you say this is a contact, or maybe you say it's a respiratory, but obviously they said it's pneumonia. So now pneumonia, this particular condition, RSV, can either be it can either be a respiratory infection or a contact infection, because obviously airborne and droplets are both respiratory. Contact is when you touch, right? When you touch the patient. So it can either be the two, right? Now, but at the end of the day, we can only establish one precaution at a time. That is what we can do. So now, since it's pneumonia, definitely we'll be establishing what? Droplet. So NCLEX needs to tell you that this is what? A droplet precaution, not transfusion-based precaution. So it is vague at this point. This is what? Wrong. Am I making sense? Now, remember when we were answering that, and let me give you another key right here so that you understand how the NCLEX wants you to think. Every question have clue, but most of the time we don't spot the clue. Let me give you another good, right? Let me give you another good. Now, remember when we were answering that particular question on ECG, right? We spotted a lot of heart rate, and then we're thinking that question is about heart rate. Now, there's one thing you can still spot right here. NCLEX is talking about assignment, assigned. So it now makes sense that all this assigned is referring back to something in the question. So it's already telling me the mindset of the examiner, because this is what I tell students. You need to understand the mindset of the examiner. It's already telling me something about the mindset of the examiner, that the examiner is trying to test me on assignment, not this and not this. So now I need to look at it. Okay. All right. So it makes sense to me. The nurse is pregnant, and there's possibility, because the NCLEX is talking about assignment, it's not proper for a pregnant nurse to care for a client that is receiving this particular kind of therapy. So the NCLEX has sent you that signal. Now let's go back to what I said right here. Now, always ask, what is the test trying to make me believe, and what does a safe nurse actually do in this situation? Now, I guess we now know what the NCLEX is trying to make us believe, because that is the first thing I always used to do. When I look at my question and ask myself, what's the NCLEX trying to make us believe? The NCLEX is, look at the situation right here. A pregnant nurse caring for a client who have what? RSV, pneumonia, right? But they are receiving what? Their therapy. Now, and I have the answer key, because you need to understand what the NCLEX is trying to make us believe. Now, one is talking about transmission-based precaution. So we are trying to what? Prevent infection. Now, if you are trying to prevent infection, why do we start therapy in the first place? Because transmission based is all about airborne droplet contact. Now, listen to me. Look at the thinking. And in this, NCLEX just want to test you on room, PPE, right? Transport and hygiene, private room, right? But guess what? A patient that is receiving therapy already have a room. So should I be thinking about room at this point? A patient that is receiving therapy, obviously, I will see a particular question that is talking about maybe PPE to see this particular patient. There's nothing like that talking about PPE. There's nothing like saying, okay, patient is about to be transported. There's nothing like in the option that is talking about hand hygiene. There's nothing that's talking about private room, because obviously they have what? A room. There's nothing that is talking about cohorting 2 or more clients together, because this is the whole and question that NCLEX can test related to airborne droplet contact. I'm not seeing anything like that, but I'm seeing more of assignment. So now it now makes sense that what the NCLEX is trying to make me believe is that there's a danger that can affect the nurse, because I'm not seeing anything related to the patient right now in my answer key, but I'm seeing more of things that's related to what? The pregnant nurse. So it makes sense to me when I'm thinking about there's something about this therapy that can be a problem to the pregnant nurse that is causing the NCLEX to make me believe it's all about changing the assignment. So guess what? Number 1 is not going to be my answer. I'm left with 2, 3, 4. So request a change of assignment from the charge nurse, discuss the assignment with the physician, switch the assignment. Now NCLEX is testing you on what? The ability to assign. So what is the test trying to make me believe, and what does a safe nurse actually do in this situation? So now we are going to what? Request what? A change of assignment. That is what we are going to do, because a safe nurse will request a change of assignment from the charge nurse. Why are you discussing your assignment with the physician? Will the physician help you change the assignment? Obviously no, because this is going to be a problem to you. So physician will not help you change the assignment. The charge is just like now, who prescribed medication is that particular person that can that you can clarify the medication with. So if a medication dose is maybe wrong, you clarify back with the doctor. You cannot clarify with the charge nurse, because charge nurse did not prescribe the medication to you. Same way with assignment. Who create the assignment? The charge nurse. So who's going to change the assignment? The charge nurse. So why are you discussing the assignments with the physician? So this is wrong, right? Now, you don't switch assignments with coworker without the knowledge of the charge nurse. So that is also wrong. Okay, now, so the correct answer is what? 2. You can see, right? All these things, I saw it in less than 1 minute of reading the question. Everything I just broke down for minutes right now, I just saw it in less than 1 minute, because I have the ability of interpreting question, and this is what I want to give to you. That ability to see any question on the NCLEX exam and understand it fully. But it all starts with understanding one key thing, right? Let me put it here. You need to understand the 3 key things, because you cannot skip process. 1 is the content, 2 is understanding how the NCLEX write the question, right? And then you understand how to break it down. If this is missing, you cannot know this. If this is missing, you cannot know this. So all this, once you master this key thing, then we can now start breaking question together. Right. It take you 30 days to finish all this, then 2 weeks for question, another 2 weeks for strategy. Right. And I'm going to give you all the thinking process. So if you need my help in passing the NCLEX exam, reach out to me. +1767 613 0769. And I can guarantee you, you are going to pass the NCLEX exam in 85 questions. So see you in my next video.